And physicians have said that they know how to stop people from dying from hypertension and heart disease and diabetes and those kinds of things. They said basically do two things. Number one, figure out how to get past their office manager to see them if you don't have health insurance. That's the first thing. If you can get to see them, then they can prolong your life or keep you from dying from some of these related diseases. And then the second thing is to be able to afford the medications that they would prescribe for you. And I want to say that that's part of the reason why I'm here tonight, because oversimplifying, those seem to be two simple things, but for some people, particularly people from my community, those are two monumental obstacles that they face. And the inequities in the healthcare system actually have a lot of costs associated with them, and I'll talk more about that a little bit later on. But thank you for being here.
Thank you, Reverend Patterson. Harry Bryant.
Thank you, George. I'd like to talk a little bit about what are actually in the bills being considered by Congress. Because I've done a number of these town meetings, and I find that most people don't understand what are in the bills. The 5 committees have looked at this bill, and in all 5 committees, the underlying philosophy is that we're going to extend health insurance to virtually every American, probably not as many as I would like, virtually every American. And in exchange for that, we will get fundamental changes in the healthcare, in the insurance industry. And many of you are you're like most West Virginians. Virtually everybody in this audience has insurance. So the first question is, well, why should we care about extending health insurance to the uninsured? And I think there are 2 primary reasons. One, as Reverend Patterson pointed out far more eloquently than I can, the uninsured live sicker and die earlier than those of us fortunate enough to be insured. Families USA found that 4 West Virginians will die this week because they lack health insurance. Next week, another 4 West Virginians will die because they lack health insurance. It is, in my opinion, a moral imperative that we extend health insurance to every American. The other reason is it's a sound economic policy. The uninsured, as Pat White will tell you, would seek care. First they put off seeking care. So when they're diagnosed, their treatment, their illness is at more advanced stage, more difficult to treat, more expensive to treat. And absent her clinic, they will seek treatment in the only other places they're guaranteed access. That's emergency rooms and hospitals. Emergency rooms are a lousy place, not only a lousy place to offer primary care, they're enormously expensive places. And those costs are passed on to us. As Fred Earley will tell you, it's about $1,000 a year for the uninsured for family policy in West Virginia to treat the uninsured. So I think there are 2 reasons, again, to cover the uninsured. One is a moral imperative, the other part is that it's sound economic policy. So all 5 of the committee bills extend health insurance to the uninsured. They do it in a variety of ways. They do it basically in 4 different ways. They all establish a health exchange. Think of a health exchange as really a farmer's market for health insurance. An insurance company like Blue Cross Blue Shield goes to the health exchange. They say we have an adequate reserve fund, we have an adequate network, we have consumer protection, and the government certifies them as being able to sell their product in the health exchange. The health exchange has been enormously successful in Massachusetts in helping to drive down the uninsured. The second and probably one of the more important things they do is they extend Medicaid to low-income adults. Most of you probably think Medicaid already covers low-income adults. It does not. It covers children very well. But in West Virginia, in order to qualify for Medicaid, you have to have children, and you have to earn less than 35% of the federal poverty level. About $6,000 for a family of 4. Earn $7,000, and regardless of how many children you have, or not, if you have 3 children and you're a single mom, you still don't qualify for Medicaid. All of the 5 bills extend Medicaid, most of them up to 133% of the federal poverty level. This will expand Medicaid in West Virginia probably to 100,000 low-income adults. We'll cut insurance rate by 1/3. The greatest expansion in Medicaid's history is 45-year history. Third, there is a divergence of opinion about an employer mandate and requiring employers to offer health insurance to their employees. The House requires it. The Senate has what's called a free rider arrangement. It says basically you only have to pay if you don't cover your employees. If your employees qualify for a subsidy, then you really only have to pay for that subsidy. The incentive there is not to hire low-income employees, because the higher income employees are not going to qualify for that subsidy. The fourth is an individual mandate. An individual mandate saying that if insurance is available and affordable, then you have to purchase it. And they all contain significant subsidies for moderate and middle income individuals, up to 400% of the federal poverty level, which is about, for a family of four, about $88,000 a year. So you see it reaches really particularly in West Virginia, into the middle range. And George, let me just conclude, just giving you an understanding of the insurance reforms that we get in exchange for the expansions of health insurance. There's been a lot of talk about no more pre-existing conditions, and that's exactly right. People will no longer be subject to a pre-existing condition. But it's not just that. Women will not be charged discriminatory rates, because women are responsible for childbearing and have more health care needs than men. They are typically charged higher premiums than men, and that will end under this reform. No more cherry picking. If I show up at an insurance company, they have to sell me an insurance policy. It's called guaranteed renewal. And if I get sick and use that policy, they can't drop me. It's called guaranteed renewal. I get to renew that access. And there's no more medical underwriting. No more saying, you know, you have diabetes, your premiums are now $20,000 a month. And there's no more lifetime limits. So the cancer victims who have enormously expensive care could be paying their premiums all along, reach their lifetime maximum, and lose their health insurance coverage currently under the reform that will not occur. Finally, at least in the House, there'll be no more astronomical administrative costs. It's called the medical loss ratio. It basically says the premiums you collect, an insurance company collects, they have to spend 85% of that on claims. Only 15% of that can be spent on profits, promotion, and other things like that. Any one of these reforms would have been breathtaking a couple of years ago. As a package, they fundamentally change how the health industry will operate. I think it's remarkable. The insurance companies, the insurance industry, to their credit, has agreed to all of these. And so we're going to see fundamental changes in the insurance industry, and I think that is a welcome change.
Thank you, Perry. And it's a good segue to Fred Earley with Blue Cross Blue Shield. Fred?
Thank you, George. And I wanted to thank Perry for including the panel, and also wanted to express my appreciation for everybody that showed up tonight. One of the advantages of going later in the agenda is that I was able to tick off a lot of points I made because they've already been made by several of the speakers here. So I think I was actually kidding some people in our office today that my purpose for being here tonight was to put a face on the face of the insurance executive that you heard referred to in some of the rhetoric and debate that's going on. I have to say with a caveat that for Mountain State Blue Cross Blue Shield, we're a not-for-profit company. So I'm not sure that, and we're also relative to the national models that you see around the country, particularly in the for-profit variety, that we probably don't qualify as either large or some of the other descriptions that have been given on a national basis. But nonetheless, I guess from West Virginia perspective, what you see is what you get, but I am pleased to be here as part of the panel tonight. Also, in reference to the comments of Reverend Patterson about the ability to speak briefly, prior to taking over my position as president of Mountain State, I was his general counsel, so I'm equally challenged as a lawyer to try to speak briefly as well. And I will do the best I can.